The patient is a 7-year-old girl from Venezuela who has spent the past 6 months in Colombia as a refugee. She has been enduring difficult living conditions, residing in cramped quarters alongside her mother and other migrants. The patient initially presented low-grade fevers up to 38 degrees centigrade for 2 days before admission, associated with cough and rhinorrhea. She was treated with acetaminophen by her mother and did not receive medical attention at the time. Before admission, she undertook a long bus trip during which her state worsened with fever, abdominal pain and vomiting. She developed a purpuric and painful rash initially on her face, which rapidly spread to the trunk and extremities. She appeared ill and with pain, but her vital signs were normal. When she arrived at her destination, she was rushed to the emergency room of a high-complexity regional public hospital, where she was admitted. Her vaccination schedule was incomplete. She presented with a fever of 39 degrees centigrade with vomiting and diarrhea. Initial laboratory evaluation included a complete blood cell count, with leukocyte count 9,130 cells per cubic millimetre, with normal differential, hemoglobin 13.4 grams per deciliter, and platelets 15,000 per cubic millimetre, CRP of 1.1 milligrams per deciliter, and normal liver and renal function. 2 blood cultures were obtained before initiating empiric antimicrobial therapy. She received a platelet transfusion before undergoing a lumbar puncture. By the exam results, the diagnosis established at this stage tends to a disseminated meningococcemia or pneumococcemia. A BIOFIRE Filmarray Meningitis Encephalitis panel was ordered and was positive for Neisseria meningitidis. Blood cultures were positive with gram-negative cocci after 14 hours of incubation. The BIOFIRE Filmarray Blood Culture Identification 2 panel was ordered and was positive for Neisseria meningitidis. After the result of the meningitis encephalitis panel was received, vancomycin was suspended and ceftriaxone continued. Despite antibiotic treatment, the patient progressed to septic shock and was admitted to the pediatric ICU with vasoactive support. The patient presented disseminated petechiae but did not progress to necrosis. She improved clinically over the next few days, after which she was sent to the pediatric ward, where she completed 10 days of antibiotics and was discharged when clinically recovered. The patient survived with no sequelae. The conjoined use of the BIOFIRE Filmarray Meningitis Encephalitis and Blood Culture Identification 2 panels help to identify and treat the disseminated bacterial infection. The rapid identification of Neisseria meningitidis was key in alerting public health authorities to distribute prophylaxis to the population which had been exposed during the bus trip and in the lodging where the patient had been living prior to her symptom onset.